Assalamualaikum and hello everyone. We are from Group 9 and representing channel titled Cancer Prevention and Health Promotion for People with Intellectual Disability and Exploratory Study of Staff Knowledge. This journal is written by Ellen Hannah, Lawrence Target and Wendy Cousin. So before we will present our journal, I would like to introduce our team member. First is Tan Yanzo. Second is RABIA Sheikh ADAN HAJI. Third is me, SITI KHADIJAH BINTI YUSOFF. So, acknowledgement of author. This journal is written by three authors. First is Ellen Hannah, second is Lawrence Target, and third is Wendy Cousin. All of them is from Institute of Nursing Research, School of Nursing, University of Ulster, Co-Entrim, Northern Ireland. And then this journal is published on 13 December 2010. So table of content for this presentation is first is introduction that include aim and background. Second is method that consists of design, setting and participation and instrument. Third is result that consists of data and discussion, and fourth is the conclusion. So for the introduction, the aim of this journal is to examine how care staff engage in cancer prevention and health promotion activity on behalf of people with intellectual disability. So before we will present our journal, I would like to introduce our team member. First is Tan Yanzo, second is RABIA Sheikh ADAN HAJI, third is me, SITI KHADIJAH BINTI YUSOFF. So, acknowledgement of author. This journal is written by three authors. First is Ellen Hannah, second is Lawrence Target, and third is Wendy Cousin. All of them is from Institute of Nursing Research, School of Nursing, University of Ulster, Co-Entrim, Northern Ireland. And then this journal is published on 13 December 2010. The table of content for this presentation is first is introduction that include aim and background. Second is method that consists of design, setting and participation and instrument. Third is result that consists of data and discussion, and fourth is the conclusion. So for the introduction, the aim of this journal is to examine how care staff engage in cancer prevention and health promotion activity on behalf of people with intellectual disability. So for background, people with intellectual disability suffer from significantly more health problems than the general population. They also evident that people with ID not receiving the same level of health care as other members of society. That's why the health outcome for this group are poor compared to the general population. So as they are living longer, their chances of developing cancer also increase. Recognizing the early sign and symptom of cancer in a population with cognitive impairment and communication difficulty pose difficulties for both family carer and professional care staff. Engagement in health promotion and cancer prevention activity is also challenged, yet people with ID have equal right to this important public service as other members of population.
Okay, I'm Rabia. I'm going to continue with the next part. So we have the method, and under that we have design, settings, and participation, and then we have instrument. Okay, the design of this research was descriptive exploratory study using a postal survey employing anonymized questionnaire. Ethical approval was obtained from the University of Ulster's Ethics Committee. So the research was conducted in northeast corner of Ireland, that is controlled as UK Administrative Division, but with its own kind of devolved government. The study was undertaken by one of the 5 health and social care trustees with an estimated residential population of 350 people with ID, residing over 25 residential facilities such as nursing homes, residential homes, and supported living schemes. So firstly, Introductory letters were sent to care facility managers informing them about the study and asking for their permission to distribute the questionnaire. An information sheet explaining the purpose of the study to their staff. Completion and return of an anonymized questionnaire by care staffs were then taken. The respondents who completed the questionnaire on behalf of people with ID were either ID nurses or residential workers. In total, 40 staffs returned completed questionnaire on themselves and on behalf of 90 adults with ID, intellectual disabilities. Anonymized self-completion questionnaire was developed after a meeting of professionals working in the field of cancer and health promotion, so that cancer prevention activities with people with ID could be obtained from a large sample of residential care staffs. Okay, so the questionnaire had 3 parts. Part 1, collecting information about the care staffs regarding gender, age, job title, personal experience of cancer, and training history. For Part 2, explored staff's knowledge to recognize signs and symptoms as well as risk factors according to Cancer Research UK, National Cancer Institute, and American Cancer Society. Also, involved staffs correctly identifying signs and symptoms of 4 particular cancers: breast cancer, stomach cancer, cervical, and prostate cancers. Okay, so for the last and third part of the questionnaire, it asked each staff member for information about the individual person with ID that they cared for. It included MC questions, multiple choice questions relating to demographic information about each person with ID, intellectual disability, such as gender, age, level of ID, physical health, lifestyle, weight, height, and so on. In addition, the questionnaire collected data and information on whether staff promoted and engaged in cancer health promotion activities with each person with ID in their care, such as importance of screening, smear testing, breast and testicular examinations, and so on.
Hi everyone, I'm going to present about the results of this article. There are a total of 40 staff involved in this research. 32 of them are female and 8 are male. From the table, the majority of the staff had not received training in cancer awareness and cancer health promoting activities targeted for people with ID. There are also lack of knowledge of cancer for people with ID because the score obtained by the questionnaire from them are quite low. There are a total of 90 people with ID involved in this research. 55 of them are female and 45 are male. For the lifestyle behavior of people with ID, most of them does not have the lifestyle behaviors of smoking and also drinking alcohol. But most of them do not consume the recommended 5 portions of fruit and vegetables per day and consume the required 2 portions of oily fish per week. For the activeness of people with ID, men with ID are found to be more active compared to women with ID. None of the staff reported that they knew of any family histories of stomach, colorectal, or ovarian cancers among the people with ID. But breast cancer and prostate are the main family histories of cancer of people with ID. Only 2 ID people had ever been tested for Helicobacter pylori infection. And a number of staff indicated on the questionnaire that they did not know what the Helicobacter pylori infection was. For the cancer health promotion activities among people with ID, more than half people with ID received advice about importance of a healthy diet, either weekly or monthly, and importance of regular physical activity. However, more than half of the people with ID does not receive advice about importance of limiting the amount of animal fat in their diet at least every month. More men with ID receive advice about testicular cancer screening compared to women with ID receive advice about breast cancer screening. The next part is about the discussion of this article. Firstly, majority of staff does not receive any training in health promotion for people with ID, signs, symptoms, risks, and also protective factors of cancers. Similar results are also obtained from previous study. Secondly, ID people are lack of appropriate health care, and the main factor is the lack of family carer and professional awareness of the cancer health needs of people with ID. further development of a wide range of accessible information materials on cancer and ID is necessary. The next one is from the research. Residential care staff had little knowledge of family histories of cancer of people with ID within their care. Persons who are identified as being at an increased risk of various cancers based on their family histories should, involved in an appropriate surveillance plan, be well informed of the importance of maintaining a healthy lifestyle and also undertaking regular screening. Next is about the women with ID had higher BMIs compared with the men with ID, which will place them in the obese category. There is growing evidence to suggest that adults with ID, especially women, are a high-risk group with regard to developing obesity and its associated health risks. According to other research, there is a link between high BMI, obesity, and increased risk of cancer mortality. Lastly, is a low number of ID people receive Helicobacter pylori infection test according to this research. This test is important because mounting evidence suggests that people with ID are more likely to suffer from the Helicobacter pylori infection. However, ID staff involved in this study show limited knowledge of this infection, and only 4% of the public knew what this infection was.
For the last conclusion, first, the study highlights a need for a better staff education and training in health promoting activity that will raise awareness of the sign and symptom of cancer and also the risk and protective factor for developing the disease. As we know, many people with ID have a difficulty in understanding health literature about cancer awareness and also the importance of the healthy lifestyle. Second, cancer professionals are challenged with the important task of developing appropriate health promotion strategy to encourage and empower this group to embrace health behavior, because this can decrease their cancer risk and also enable them to live a healthier life. So that's all from us. Thank you for listening.